Major, welcome to another conversation on the Pharmacy Podcast. How are you doing today?
Glad to be here. I'm excited, actually. So we're talking about artificial intelligence? Is that right?
We are. It's one of those conversations that everyone wants to have and nobody knows to talk about.
And nobody knows what to talk about. They're like, artificial intelligence.
So
that's great.
You're listening to the Gavel and Pestle Podcast with Darshan Kulkarni. The Gavel and Pestle Podcast, where the law of the land intersects with the business of pharmacy.
I really think I'm entitled to an answer to that question.
Artificial intelligence is intelligence demonstrated by machines, in contrast to the natural intelligence displayed by humans and other animals.
It's one of the... I saw a recent bit of news where I think it was Hooters, who literally just said that they're going to have a drink called blockchain, and their stock shot through the roof. And I think artificial intelligence is one of those things, like you just use those magic words and suddenly everyone's all interested in you. You can't be a company not in artificial intelligence anymore.
So that's the formula, right?
Silly, because
take something that's been popular in the past and then add like the buzzwords. So like slap bracelets, blockchain. Actually,
exactly.
That's kind of neat.
I love how you added slap bracelets to blockchain, but that's basically the same concept.
Right? Apple pie blockchain. That does not sound delicious at all. So, but today we're talking specifically how this relates to pharmacy, right?
We are. And what we want to talk about is if artificial intelligence or AI is a real thing, what does that look like for pharmacy? So one of the things I always talk about is coming out of pharmacy school. This is such a long time ago. We read about pharmacists being replaced by ATMs. And the idea was, why do you really need a pharmacist when I can just go 24 hours a day to a ATM that's sitting in a pharmacy somewhere, maybe not even inside a pharmacy, and it'll get my information. Maybe it's some kind of fingerprint recording. Maybe it's an eye scanner. And for refills, it would just dispense the medication that I want. And in certain states, that's actually technically allowed. And I know that in certain states, again, going back a few years, I think it was like Virginia, they said that was allowed. And they were already doing that to a certain extent. It never quite took off.
I mean, I can see it with like over-the-counter drugs, right? Tylenol, Benadryl, that kind of thing. And maybe even some over-the-counters that have limits, like, pseudoephedrine, that kind of thing. But specific to prescriptions, like there's a reason prescriptions exist. You need a script for X, Y, or Z. But what's the human element there?
Is that really true, though? I mean, I guess what you're really referring to is this idea of being that learned intermediary and checking up to make sure the patient still needs it.
What about that question?
What if it's something like a diabetes medication that you're taking every day for the next 45 years? What if it's your blood pressure medicine?
But even on an elemental level, let's take it back a bit. Like, why do we even need prescriptions?
Oh, great question. So the idea again comes from the concept that a patient does not know enough about medicine. It's the same reason that you go to an architect to build a building. Yeah, you could build your own building, but that's probably not the safest thing in the world.
So you're essentially saving the patient from themselves. Like, so you don't need a prescription for safer drugs, quote unquote, like Tylenol, but to put that in that category. But you would need it for like Percocet or for other, potentially harmful medications. So
it's sometimes for harm, like you're pointing out. First of all, Tylenol is an interesting example because beyond 4 grams, it can actually start causing liver problems. So it's safe, but not as safe as one might think. And
ignoring the acetaminophen, right?
Right, exactly. When you work in a hospital every so often, you see relatively routinely people coming in with Tylenol overdose. And it's usually young women, but I've seen young men and I've seen older people all come in with these Tylenol overdose problems. And sometimes it's not even because they were trying to overdose. Sometimes it's because they couldn't tell that product A and product B both contain Tylenol. But the point being, as a pharmacist, we're supposed to be looking at that. We're supposed to be tracking that and controlling that. And from a safety perspective, but from an efficacy perspective, pharmacists are also supposed to be looking at this. Is Tylenol the right medication if you have liver problems? is Tylenol the right medication if there's an opioid crisis and you have severe jaw pain? And that's really the balancing act that a pharmacist should do. So to your point about prescriptions, what a pharmacist is supposed to do is look at whether this product is right for you, not just based on the product itself, but based on you and your disease state and any other medications you're taking. And a variety of other factors.
Well, the only reason the pharmacist is not an ATM is the human element, right? So the ability to take into consideration the patient's previous medical history, for what they can see, and how certain drugs interact with each other. Is this right for for the scenario? But assuming present day, all of those considerations can be somehow contained in some sort of AI unit, I'm sure. But what's the human element that's preventing all of this from happening?
So this is great. This is a great conversation. Every pharmacist, you talk to anyone who is not a pharmacist, and their first response would be, this is stuff that's trackable. This is stuff that can be easily figured out. And between you and me and the 800,000 people listening to us right now, right. That is totally true. Here's the flip side of that same discussion, though. Pharmacists and physicians are constantly bombarded with overwarnings. So just because it's possible doesn't mean anyone wants to do it. And let me give you an example of that. If you give a prescription for a drug and the patient's on 9 other drugs, there's a very, very, very good chance it interacts with those other drugs. What interaction is meaningful is what a pharmacist decides, what a doctor decides. And that's really the question. There was a recent talk. I went to a conference for lawyers recently, and we had one of the counsels from IBM Watson, which would be a great example of AI. And they were talking about the use of Watson in healthcare. And one of the key things he was talking about is we're not trying to replace anyone. What we're trying to do is help those people. Now, you might say, well, isn't that just an intermediate step? You'll eventually want to replace everyone.
Right.
The truth is they don't necessarily want to, because if they do, they take on the liability of things going wrong. And that's what a lot of these companies don't want. They don't want to get into the business of figuring out all the right moves based on all these different sources of information, and then finding out that someone still got hurt, because that will happen very routinely. And that becomes the problem. The problem becomes, how do you want to take on the liability? And when companies like IBM, companies that are massive, your Googles of the world, your Apples of the world, they often are saying, we can develop the AI, but we do not want to touch the liability. Because you're talking millions and billions of dollars in liability. That's
more of a leap, wouldn't you say? So for example, there are current steps for the opioid crisis that are kind of gearing up for a solution, right? Like the PDMP, the Prescription Drug Monitoring Program.
Absolutely.
Now, that's one tool a pharmacist has to essentially combat the crisis or just to be more informed about the patient. Now, absolutely, I can see AI helping, or being the tool, being a tool to help that pharmacist separate the chaff from the wheat, right? They need to separate or be able to cut through the noise and pick out. I think
that's what these softwares are saying. They're saying we'll help you cut the chaff from the wheat. What we don't want to do is tell you, here's the wheat you use. What they're saying is, you decide what the wheat is, because if you get hurt having the wheat, we don't want the responsibility.
Right.
What we'll do is we'll cut out the noise.
So,
and go ahead.
And I get that's all well and good. It's just, I think maybe right now AI, as it is, there still needs to be more steps before that's actually fully implemented. Like, there needs to be more PDMPs. Or there will be. Now, there doesn't need to be. There will be. But
there are already certain states, I believe Maine has already said that we don't want a PDMP just for controlled substances. We want a PDMP for most drugs, which will help people. For example, if a patient walks into the ER and you don't know what medications they're on, you can get a true list, which would be very, very useful. One of the things most hospitals have to do is you do what's called a medication reconciliation, which basically means that the patient comes in and you need to figure out what the medications are. Very routinely, you will find that the patient's list of medications is very different from what the doctor's actually prescribed.
Okay. And
the reason for that is because the patient takes the medications differently. And because it helps the patient, it felt bad, he got nauseous, she got giddy, she got whatever it is. And the idea is that a PDMP is one part of the tool. It does not calibrate for how the patient actually uses it.
Right. Now, I'm not saying that's like the silver bullet, and I get that.
Absolutely.
But all I was saying was it gives them more of an option or another tool to use.
Absolutely. And I think that's the key piece. I think AI will start off becoming a resource, and it's probably going to become a much bigger solution as we continue. I mean, one of the things they talk about, the Institute of Medicine put out a bit of data saying that between 44,000 to 98,000 deaths result from medical errors in hospitals alone. Mm-hmm. Of this, 7,000 deaths are related to medication. So if you've got all these pharmacists being paid, in many cases, over $100,000 a year, and you're talking about teams and teams of pharmacists. One of the hospitals I work at has almost 300 pharmacists. So you're paying these people, 300 people in the pharmacy department, not 300 pharmacists. But these teams and teams of pharmacists still can't prevent 7,000 deaths every year. So, and that's not counting the doctors, that's not counting the nurses. So the question is AI going to be able to solve that? And I think there's an argument to be made that they can at least help beat away at that number. And I think that might be part of the argument.
So, and I'm sure, in healthcare, it's all about speed and accuracy. And when it comes to like a trauma center or something of that sort. So
Absolutely.
Somebody comes into a trauma center, worst day of their life.
Yep.
Doctor needs to know everything they can ASAP. That I think is where the AI really comes into play. Once
how do you see it playing out?
In terms of whatever system, there's going to be, and probably already is, a system in place that will be a tool for information that allows that patient's medical history and other doctors to effectively collaborate much more in real time.
So, great question. So you know what I just realized, Major? We didn't actually define what AI actually is.
Right.
So maybe we're
making that assumption. So what is AI, artificial intelligence? Now, when someone says AI, people think what?
People think of HAL from what's the movie? HAL 2000.
Jeez.
Okay, you know what?
Well,
this is a question for the audience. Come on, if you could think about it, because I can't at this moment. I think it was a Kubrick movie. I know it's a Kubrick movie. I just can't remember. Tweet us, let us know which movie it is, because we can't remember right now.
We don't even know what to Google to find it. But to us, artificial intelligence is that robot that comes out and says, like, "Good morning, Will Robinson."
Exactly right. Artificial intelligence, that's what people visualize. They think about the robot. They think about Robin Williams. From,
a separate entity, a physical thing that has intelligence that's... Or
they think about Skynet.
Oh, geez.
From Terminator.
Yeah, that's fun. That's a great thought. That's, but yeah, so why would, and also in current economic times, taking the place of certain jobs or job functions, that's one of the concerns. But what we're talking about specifically is and what this is relating to is providing a tool. It's not a replacement for a position. It's more so to enhance that position's ability to do that job function much better, I guess.
And right now, I think that's where we are. I think right now the big goal is how do we get to a point where the tool can go let me help you. So right now we have issues with overwarning. We have issues with underwarning. We have issues with bad information. I think what AI will be able to do, initially at least, is separate the wheat from the chaff and basically say, look, these are the ones that really matter. Take a look. Tell me what you think. Mm-hmm. What I think the end game, however, and this is where you as a company make billions upon billions, but in exchange for that, you take on liability of billions upon billions. We're just hoping the scale of billions are different. But the point is that if you can get into saving a hospital millions upon millions every single year in just healthcare, and sort of costs associated with healthcare practitioners, whether it's pharmacists, whether it's physicians, and we can talk about what's happening in the field of physicians, where there was several years ago, I think this was like 2006, there was a robot that conducted a fully an AI that did a surgery. This was in Italy, all by itself. So it's not like physicians are safe. You take the Da Vinci system, you add an AI to it. How is that really that far off? We already know that this can happen.
But I think that's the argument of like outsourcing robotic kind of thing, like with AI. Like I think right now the focus specifically is to just provide a tool set, a broader ability.
But do you remember how in maybe 2002, 2003, and some of you guys weren't even born then, some of you guys listening to this, you weren't even born then, but I remember listening to Dragon Naturally Speak, and I had this wonderful memory of going, one day I'm going to be able to speak to my computer, and it's going to type out my notes for me. Today we have Siri, today we have Cortana, today we have Alexa, and they're doing a lot more than typing my notes. And I think that's what the future is going to be. It's going to start off with us saying, it's going to help me make decisions. Tomorrow's going to take my job. And what does that look like? And it's not a hypothetical. I think it's something that people are truly worried about. It's something that Elon Musk and Bill Gates and every serious person in any kind of AI technology has an actual concern around this. I mean, we take you go, well, think life is much more complicated, much more complex. But as we all know, self-driving cars are already here. The first self-driving truck is actually on the road. I read that yesterday. I think Amazon just put their own self-driving truck on the road.
Google data centers are using Tesla rigs to haul their materials.
Was that what it was?
Okay. That's what I read, yeah.
Okay. I sometimes get my Reddit wrong. But yeah.
But I mean, even still, that, regardless, you're right. It's not, you're not off base at all.
Right.
So
that's
one of the things with AI is the creativity aspect, right? So that's kind of why I was like resistant against like something like surgeons or something of the more creative, pharmacists. There's a level of creativity with pharmacists because they have to be able to interpret and engage the person and, how are they feeling today? How are you going to approach them with this information in the best way that patient is going to be able to, absorb the information, won't shut you out, and will come back for more because they appreciate you and that connection you've made. Like that aspect is not, you can't program that.
Sure.
Yet.
Now tell me a little bit about the fact that people would say the same thing about their money. And how people want to feel safe getting their money from someone they trust until they got ATMs and they were told they could get their money at midnight while they were half drunk going to a club.
But there's always that risk.
I love that.
There's always that risk that something bad is going to happen, that there's going to be, a coding error and the stock market crashes or something happens. Like that's just a risk that we assume and accept in exchange to utilize this technology. That's just part of the world, but part of that scape.
But I think what AI is going to offer as we continue is this idea that artificial intelligence can learn faster. Mm-hmm. They did this study that I thought that was interesting, where they took a dermatologist and they said that the average dermatologist apparently goes through about 200,000 cases in their entire lifetime. They took an artificial intelligence and tested it. It went through 120,000 cases in 3 months. It was as good as a person who'd done dermatology for half their life. That's how quickly AI learns.
Right, and there's always going to be that, like those cases you can pigeonhole, but then you have those fringe cases that won't be able to be serviced by that. And I
Absolutely.
think,
so maybe that's the future, right? You get specialists. So not everyone becomes a pharmacist because you've got to meet everyday daily needs.
And then I don't think anybody likes to be down that production line, because then it becomes that perfunctory, like, you are this, you're classified as this. It's like, but you're right.
Yeah.
That realization.
And I think pharmacists talk about this every single time. They talk about the fact that they work in many of these retail chains, and they worry that they do the same grind every single day. Now, when they say, when you're reaching a world, and this is through social media, this is through AI, but you're going to need to reach a world where you do something special. What they're hiring you for is your uniqueness and not your ability to conform. And I think that there is that world's not far off. I mean, on social media, people are becoming, when you talk about YouTube, nobodies are becoming sensations because of their YouTube videos.
Anymore.
I've gotten jobs off of LinkedIn.
Right.
And that's because I position myself in a unique way. And I express my opinion in a unique way.
But that's still, you're still taking a chance. And the reason I say that, and I'm sorry to interrupt, but the reason I say that is I've known people to go to school, for example, in like early 2000s for cartography. Mm-hmm. They go out and they try to find a job, and then all of a sudden Google Maps comes out, and everything all the opportunities that they had that were open, all those doors closed, and then they had to go back to. So like, it doesn't. You have to kind of be able to. There's definitely a risk factor involved, right, in choosing that direction.
See, I disagree with you on that, because I think that anyone who was doing cartography when Google Maps came out should actually have faced a job boom. Because can you imagine how many people are right now working at Google and at Apple who need to have cartography skills but need to understand that in the context of technology? And I think that's really what AI is going to force. It's going to force evolution. You're going to have to stop thinking of yourself as a single job. Like, most people are used to this idea of, I will get a single job, and that will be my job for the rest of my life.
With regards to that example, it became a point of oversaturation in that field.
Sure.
So like, because, one person could then do the job of, and I'm just throwing a number out there, like 100, right? So because of technology and how that works. And actually the thing now is, I don't know if you know about the back end of Waze. Now, I'm not saying the back end in terms of the coding aspect, but there is an element that they reward users for, to actually go into a map and draw streets with vectors. And so you get points according to how many vectors get approved. So like all these back roads through Waze, those are programmed by somebody who lives there or who knows the area. I didn't know that. And so if there's construction, I'm sure that does other things. But if there's a new road, I'm sure users are all over that in an instant who are familiar with the area, because they can then manually go in there and edit. And it's its own community, to where you have different, like a hierarchy system. So like, this person can edit this, and someone else has to approve it, and that just kind of goes up until it's involved in the whole thing.
And I think that's the point you're making, and that's the point I'm making, which is, as AI comes into pharmacy, it's going to become about people contributing, and there are already movements like that.
Absolutely.
Where people are saying that people are going onto websites and reporting their own adverse events. And then, instead of a pharmacist who has to scour the entire web, an AI will go out and scour the web and say, you know what? We saw this person on Twitter in 2006 who reported the same adverse event.
Like, I don't know why I'm so scared of that. Like, it kind of reminds me of like loan applications. Like, isn't there like a company in China that will like look at your social media? There's actually, I did read something about that, where like, if you miss a payment for a loan, they'll then share it on your social media accounts. Like, so it's like public shaming.
So public sharing and public shaming. If you will.
Which is really not an ideal scenario. But anyway, going back to the pharmacy space, what else do we have to add to that? Like,
I mean, we can talk about the fact that AI tends to be less error prone. AI tends to be tends to have a much faster speed in learning, and it tends to be just plain cheaper. But the question becomes, is it a replacement tool? And I wrote an article for Pharmacy Edge magazine that'll come out soon enough, and it'll put out one position that I have. But I think that the position I put out there is not as nuanced as I really field, because I think you've got to put out something on that sort of puts out a position. But the understanding and the future is actually more nuanced. And if you are engaging in pharmacy, it's important that you understand not just where things are, but where things are going. And if you're going to engage in artificial intelligence, you need to understand how that fits into things like the Internet of Things. And you need to understand how it fits into just the general concept of futurism. And you need to understand how this is all coming together. And there are curves we can share that talk about whether it's wearables. You can talk about things like pharmacogenomics, and you can talk about the fact that pharmacists will now have to input information from all these different data sources. And can pharmacists do that? Are pharmacists going to become, in the future, are pharmacists going to be the ones looking at wearables and looking at data from wearables to help patients who are already communicating who can't go to the doctor because the doctor is already dealing with far too many inputs, and the pharmacist becomes your default provider? What does that future look like?
I have a question for Darshan, the pharmacist. If you had a tool that, if you had an assistant who would provide you with information with the patient in front of you, who just gave you a prescription, and it gave you everything you needed to know, including if you had that medication in stock.
Right.
What tools would that eliminate, and how much faster do you see that interaction going?
So,
and I don't mean like you don't have to name specific tools, just like estimate, like 10, 3, 2.
So the problem again is not the physical dispensing, right? It's never been, can I get the pill out fast enough? It's always been things like, do I need to get prior authorization from the insurance company so that this patient can okay it? Can I get more information about the patient? Can I get, it's not, I could eliminate all of it, and I could just literally pull out the pill bottle from behind and write out the prescription. I've had to do that when there are power sort of losses. But there are also situations where you're talking about how your question's less about how much does it eliminate, and it's really more about how much does it augment and how much does it improve. And what you're really saying is, if I could get live data on, there are these patients right now in this area who are all suffering from the flu, this patient fits that profile, that's why it's probably okay to give this medication. That's live data that I don't have. All I have is a gut feeling because I've had 15 patients come through in the last 2 weeks. If I knew that there's a better trending out there, for example, Google did a study, and I'm vice president at a company called Synchrogenics, and one of the people we have on there is a guy called Jim Nasser. And Jim is one of the foremost world leaders on artificial intelligence and on blockchain. And we have these conversations, and he was heading the CDC when it came to these open platforms. And Jim and I talk about these things is often enough, where we talk about the fact that Google tracked based on searches being done, how the flu was spreading. And turns out they were more accurate than most companies out there, and most physicians out there, most healthcare providers out there. And that's going to be the power of AI. The power of AI is going to be able to see not just individual trends, but mass trends, and to be able to compare that and apply that to individuals. And that's something that the individual pharmacists simply can't do.
Access big data, right?
Access big data, and access big data that's personalized. Right now, what you have is this problem around data land grabs, if you will. This idea that everyone wants to say we control this data. I mean, literally, the Roomba is saying we control the data to what your rooms look like, what your houses look like. MoviePass is coming out and saying we can tell you when you left your house and when you actually walked to your car and where you went after the movie and what you watched in the movie. Everyone's doing a land grab around data. And imagine the land grab, and companies like Microsoft tried to do that around health, and they weren't particularly successful because there are a lot of limitations to that power. Things like HIPAA limit that to a significant extent.
Well, I mean, you know about Target, right? And how they collected data, and then they send a letter to someone's it's been right. Like, would your congratulations on your pregnancy, something like that, something along the lines that. So
I'll tell you the story. The story was fascinating.
It is.
The story was this young 16-year-old girl, I think. She went to Target, bought a couple of things, and
this is all being tracked. This was like a car on a card or something, some way that they were tracking.
So she just scanned her Target card,
right? Target card,
and she went home, and she got a letter several days later with a congratulations on your pregnancy, and her dad was very upset, and he goes,
"Really?
She's a 16-year-old girl. What are you talking about?" Turns out that Target found out that people who buy these 3 or 4 or 5 elements are usually pregnant, and therefore they send them out a set of coupons. And
that's what it was, the coupons, right?
Right. And the dad didn't know, but the daughter was pregnant. And that's the scary world we live in the future, where data is going to tell us more about what we're going to do before we know what we're going to do. And before we tell people, and what does that world look like?
Don't tell me what I'm going to do. What am I going to do?
I mean, I literally saw this yesterday, or maybe it was today, where they're talking about now using lasers to see around bends, because they want computers and they want the cars to predict things faster and before they happen. So.
Jesus.
Just keep that in mind. This world is changing, and pharmacy better change. Are we going to get into a world where pharmacists are dispensing based on guidelines?
Right.
Because if that's the world we're aiming for, what prevents a computer from saying, you gave aspirin, step 2 of this process is to give 2 metoprolols, 100 milligrams, and then measure for tachycardia and see if the patient's suffering from bradycardia. Mm-hmm. You can follow an algorithm. A computer can follow an algorithm better than most people can. It can take in more inputs. What we as a pharmacist or as a profession need to start thinking about is, if all of that is true, what is your unique addition? And I have students who ask me this question about what is my role as a pharmacist? And most pharmacy schools, in my experience, this is my experience going to pharmacy school as well, was that they push the residency. I think the residency is great for people who want to practice pharmacy in a hospital setting for the next 3 to 5 years. Mm-hmm. The next question is what happens beyond those 3 to 5 years. And that's really what you should be training students who are going in right now. And no one's really answering those questions. Mm. And if you message me, maybe we'll talk about that a little bit more.
If you have questions about what we've discussed in this podcast or how artificial intelligence will affect your pharmacy or general pharmacy strategy, reach out to us on Twitter at Kulkarni Law Firm. That is KULKARNI Law Firm.
Message us.
Website, kulkarnilawfirm.com, and contact Darshan Kulkarni directly at 215-948-8183. That's 215-948-8183.
Hey, this is Darshan. Thanks for listening in. I really want to talk to you. Reach out to me on Twitter. I'm at FDA Lawyers. You can also find me on LinkedIn at Darshan Kulkarni. And if you want to find me any other way, well, start with Twitter, but you can always email me as well. Darshan at conformlaw.com. Thanks for listening in. I'm really excited to hear from you.